Hello guys. So now we shall be discussing regarding the anatomy of the frontal bone. Okay. So in this picture over here, whatever bone you are able to see over right now here is your frontal bone. So this picture over here is called as your frontal bone, right? So this frontal bone, whatever you can see, is from the anterior view. Okay. Now this is from the lateral view. From the lateral view, you can look at the frontal bone over here. Okay. And you see this is a frontal and this is the parietal bone. And where is occipital? This is your occipital bone. This is your temporal bone over here. Okay. So these are the different parts of the bone. And next important thing over here is that what we shall do is that we shall study what are the structures that are located on the frontal bone from the external surface as well as from the internal surface. It means we will study the external surface first. We will study the external surface and we'll remove the frontal bone and study the internal surface also. What are the structures that are located there? Okay. So first let us look at the structures that are located from the anterior view. From the anterior view. Now, what are these structures that are located from the anterior view? First of all, let me draw the picture and then I'll show you the bone. So, this is the frontal bone all the way. Right? And next important thing over here will be this is a section. Right? And here down you have got another bone over here which I will highlight it later on. Now, here you can see few important elevations like this. And you can also see a small opening on both the sides, right? Now, let us see what are the structures over here, right? Within this frontal bone, okay, within this frontal bone, there are actually three parts of the frontal bone. What are the three parts of the frontal bone? As we have discussed the previous lectures on different bones, we have discussed the parts of each bone, right? So, in the same way, in the frontal bone, there are three parts. One is called as a squamous part of the frontal bone, next you got is the orbital part of the frontal bone, and next you have got is the nasal part of the frontal bone. So three parts. One you have got is a squamous part, orbital part, as well as the nasal part of the frontal bone. So where is the squamous part? Just look at the picture right now. First of all, let us discuss the orbital and nasal, and then the squamous will be easy. So let us say the orbital part or the nasal part. So you can see this part which I am highlighting right now, right? So this part of the bone which I am highlighting right now is called as your nasal part of the frontal bone. After that, this part which I am highlighting right now is called as the orbital part of the front. Okay, so this is called as your orbital part. And after orbital and nasal is done, the remaining part, see this entire part, right? So all this entire part which I am highlighting right now is called as a squamous part. So there are different parts. One is called as the orbital part, nasal part, as well as the squamous part over the frontal bone. Okay. So let us name these parts. So this part over here is called as the squamous part of the frontal bone. Squamous part of your frontal bone. Now after the squamous part of your frontal bone, this part over here is called as the orbital part. Orbital part. And this part over here is this part over here is not orbital, this part over here is called as a nasal part. Nasal part, and this one over here is called as your orbital part. Orbital part of your frontal bone. Next important thing is that just above the orbit you got this structure over here. This is called as a margin, which is a semilunar shape. Okay, so this one over here is called as a supraorbital margin. So this one over here is called a supraorbital margin. On the surface of supraorbital margin, you see an opening, a foramen here. So this foramen is called a supraorbital foramen. supraorbital foramen. So overall, what are the structures so far we discussed? We discussed that there are three parts. One is squamous, orbital, as well as the nasal part. Now this is the squamous part of the frontal bone. Next, this is called as the supraorbital part of the supraorbital margin. On the supraorbital margin, you have got a foramen called as supraorbital foramen. Now let us look at this bone. Now what are the structures you can see? See, this entire structure over here is called as your squamous part of the frontal bone. This is called as your squamous part. And what is this part called as? This is called as the nasal part, right? And finally this is called as your orbital part. Now after these three parts are discussed, you see this opening, this foramen, this is called as a supraorbital foramen. This is called as a supraorbital foramen. And this margin which you can see like this margin is called as a supraorbital margin. Supraorbital foramen, and the margin over here is called as a supraorbital margin. So these are the next important structures which you can see. What we shall do is that we shall just turn this bone, okay? So actually this is how the bone is. This is the frontal bone, right? So from the front side you can see the convex surface. Now as I am turning it on the back, you can see the concave surface. So from the back, from the posterior view, how does the bone look? So from the posterior view, this is how the picture looks. This is how the picture looks from the posterior view. Right. So this is how the picture looks from the posterior view. Now in the posterior view also, you have got the frontal part, you have got the orbital part, you have got the nasal part, right? So where is the frontal part over here? Just guess where might be the frontal part. So this entire part which I am highlighting right now again. So this entire part over here is your frontal part. So in this frontal part, this yellow color part, whatever I am highlighting right now, is called as what? This is called as the squamous part. Okay. So which is the largest? Squamous is the largest, or the other two are the largest? Squamous will be the largest. And after that, the next part, what I have given a color, that is the orbital part, right? So this part over here is called as your orbital part. Okay, this part over here is called as your orbital part, and finally the center one over here is called as your nasal part. Clear? And again, not to forget that again this one is also your squamous part on either sides like this. This is also your squamous part. So in this part, what are the other structures we have got? We shall just discuss right now. Now in the center you can see a sulcus like thing. This sulcus in the center is called as a sagittal sulcus. This sulcus in the center is called as the sagittal sulcus. After the sagittal sulcus is done, you see this part, the orbital part. The orbital part is having a fossa, and this fossa is called as trochlear fossa. This is called as trochlear fossa. Okay, and obviously not to forget this thing, that in the center here you have got an aperture, you see here, right? You have seen an opening, a white color opening which I am drawing here. Right, so this particular opening is nothing but called as a foramen, and this foramen is called as supraorbital foramen. So this is called as supraorbital foramen. This is called as supraorbital foramen. Next important thing is that in the front side you have got this particular ridge-like structure on both the sides. You see this ridge-like structure in the center which is located here, this one is called as frontal crest. This is called frontal crest. So can I tell you like this, that sagittal sulcus is in continuation with the frontal crest? Yeah, it is in continuation with the frontal crest. Next, on either sides of the frontal crest, this entire part which you can see like this, right, on either side here, this entire part is nothing but called as your frontal sinus. So this one over here is called as your frontal sinus. This one is called as your frontal sinus. So let us look at the same structures over here. Okay, so if you look at the same structures over here, what are the different structures you can see? The first important thing is this center one. What is this center one called as? This is called as sagittal sulcus. Sagittal sulcus. After the sagittal sulcus, you see a crest over here. This crest is called as a frontal crest. Frontal crest. And what is this particular fossa over here? This fossa over here is called as your trochlear fossa. Trochlear fossa. And you see an opening over here. This is called as the supraorbital foramen. Supraorbital foramen. Okay. And not to forget that this sinus over here is called as your frontal sinus. This sinus over here is called as your frontal sinus. So these are the structures that are located over here. Okay. Now, one very important thing I want to tell you here is that out of all the parts, the squamous part is the largest component of the frontal bone. So, for your notes, I am writing it. It is the largest component of the frontal bone. So, this one will be the largest component of your frontal bone. Now, within the internal features, I drew few internal features over here, but there are, other than this, there are some more internal features which you have to know. I'll write it down here. First internal feature, all of you know that it is having a sulcus called as sagittal sulcus. I have already discussed this, right? So it is having a sulcus called as sagittal sulcus. So here this sulcus which you can see in the center internally is called as a sagittal sulcus. Sagittal sulcus, right? So what kind of sulcus is this? This is within the sagittal sulcus, obviously. Which sulcus will you lodge here? Superior sagittal sulcus. Second important thing is that this sagittal sulcus extends down, sagittal sulcus extends down to form another important thing that is called as frontal crest. Frontal crest. So this is what I told you if you remember. Right. So here in this picture, this is the sagittal sulcus. Sagittal sulcus is extending down to form the frontal crest. Here also, sagittal sulcus is extending down to form as this crest over here called as frontal crest. Now, third important thing which is not given in the picture is that we even have got a groove for an artery called as anterior meningeal artery. We even have got a groove for anterior meningeal artery. We even have a groove for this anterior meningeal artery over here. Next, fourth important, there is one more sinus, I think. What is that sinus? Frontal sinus. Fourth important thing is that we have got frontal sinus. So out of all the features which I have shown you in the picture, these features which I have written right now are very, very important, which are in relation with the internal features of the frontal bone. So sagittal sinus is one. Next, we have got the frontal crest. We have got a groove for the anterior meningeal artery, and next we have got the frontal sinus. These are the structures that are located internally. Now, if you look, what are the muscles that are attached to the frontal bone, right? So there is only one muscle that is attached to the frontal bone. So if you look at the attachments, when it comes to the muscle, there is only one muscle that is attached to the frontal bone, that is superior oblique muscle. Superior oblique muscle. Apart from the superior oblique muscle, you have got the second important thing that is called as falx cerebri. Falx cerebri. So I hope all of you know what is falx cerebri. Falx cerebri is nothing but the fold of dura mater, right? So for example, let us say this is the cranial cavity. You see, this is your cranial cavity, for example. Let us also tell that this is the surface of your brain. Okay, this is your brain. Surface of your brain. All of you know that the dura mater we have got, in middle we have got arachnoid matter, and inner we have got pia mater. So in the cranial cavity, the dura mater is of double layered. Okay, so actually this is the outer layer of dura mater, and this is the inner layer of dura mater. Outer layer of dura mater is facing towards the skull cavity, the skull cap. That is why it is called as the endosteal layer. And next, inner layer is facing towards the brain meninges, so you call it as brain meninges like arachnoid and pia mater. That is why you call it as meningeal layer. So this dura mater at some points, right, this dura mater will separate like this. You see how the dura mater is separating? This dura mater is separated at some points. So the points where the dura mater is separated here, these are called as dural venous sinuses. And not only that, you see the fold of dura mater coming down all the way, and what it is doing, it is separating both the cerebral hemispheres also. So this fold of dura mater which is separating both the cerebral hemispheres is what is called as your falx cerebri. And where is this falx cerebri attached? This falx cerebri is attached all the way to the crest, the frontal crest. Okay, in the frontal bone you have got frontal crest, right? So to the frontal crest, this is attached in this way. Okay, right. So there are two attachments, superior oblique muscle as well as the falx cerebri. Now let us see how is a frontal bone formed. What are the different connections to the frontal bone? If you look at the frontal bone, what are the different kind of articulations of frontal bone? With how many bones the frontal bone is getting articulated? So to look at that, you have to know what are the different kinds of bones that are attached to the frontal bone. So there are unpaired bones that are attached to the frontal bone. There are paired bones also. So to this frontal bone, there are two groups of bones that are attached. What are these two different groups of bones that are attached to this frontal bone? So one group of bone which you can see over here, one group of bone are called as the unpaired group. Another group of bones are called as a paired group. So two groups, one is called as your unpaired group and the other one is called as your paired group. So what is this unpaired and what is this paired group? Within this unpaired group, you have got two bones. One is called as ethmoid and sphenoid. They both are unpaired. So one is your ethmoid and the other one is called as your sphenoid. So these two bones over here are unpaired groups forming the frontal bone. When it comes to the paired, look here, the first important thing is nasal bone. Second important thing is your maxilla. Third important thing is the lacrimal bone. Fourth important thing is the parietal bone. And fifth important thing is the zygomatic bone. So all these bones are paired bones which articulate with the frontal bone. Unpaired bones which will articulate with the frontal bone are ethmoid and sphenoid, and paired bones are, these are the structures which articulate with the frontal bone. Next, whenever you look at a fracture of frontal bone, what will happen is that most of the fractures are depression fractures. So whenever there is a fracture, this part undergoes depression. I mean this part, whatever the frontal bone is there, it undergoes depression inside. So as you can see, as you can look at this image over here, in this you see the frontal bone is fractured and frontal bone has gone inside, right? So such fractures are called as depression fractures. So there is depression in anterior table of the skull, in the anterior table of the skull. Okay, so this is one of the very important thing which you need to know over here, anterior table of the skull. So this is regarding your frontal bone. Okay, so let us just revise the things which we have just discussed. So frontal bone is very short, and here you can see frontal bone has got three parts: squamous part, orbital part and nasal part. Squamous part is the largest. Next, here we have got supraorbital margin. Above that we have got a foramen called as supraorbital foramen. Next we have got the nasal bone and the orbital bone. After that, over here you can see the squamous part, supraorbital foramen, orbital, nasal over here. And this sulcus over here is called as a sagittal sulcus. Below that you have got the frontal crest. On either sides of the frontal crest, the sinus which you have over here is called as a frontal sinus. Next important thing is, this is sagittal sulcus. Sagittal sulcus is in continuation with frontal crest. Okay. Attachments, superior oblique muscle and falx cerebri. So these are the structures. Frontal bone is divided into unpaired and paired. I mean, these are the articulations. Okay. Remember that these are the articulations. Articulations means these are the bones that form joints with the frontal bone. Okay. So thank you so much for watching my video. Goodbye.